How often do I need cervical screenings? Imagine catching a problem early before it becomes serious. That's what cervical screenings are all about. The key is knowing when to get checked and how often. For women aged 21 to 29, the standard recommendation is to have a Pap test every 3 years. This test looks at cells from the cervix to spot any abnormal changes early. It's important to start screening at age 21, regardless of when you become sexually active. And screening before 21 is generally not advised because cervical cancer in very young women is rare. For women aged 30 to 65, there are a few options for screening. You can have a Pap test alone every 3 years, or opt for a high-risk human papillomavirus test alone every 5 years. Another effective choice is co-testing, which combines both tests every 5 years. The high-risk HPV test detects the presence of virus types most associated with cervical cancer, so doing it less often still provides strong protection. These intervals are based on the higher sensitivity of HPV testing for catching potential problems early. Once you reach age 65, screening can often be stopped if you have had consistent normal results in previous tests and no high-risk factors. If you've had a hysterectomy that removed your cervix and you have no history of serious cervical disease, you usually don't need further screening. However, some women may need more frequent screenings. If you have a history of abnormal Pap tests, precancerous changes, or high-risk HPV infections, your doctor might recommend more regular checks. Women with weakened immune systems, such as those with HIV or who have had organ transplants, also need closer monitoring. If you have had cervical cancer or treatment for precancerous lesions, your healthcare provider will personalize your screening schedule to keep you safe. It's essential to follow these guidelines because regular screenings help find early signs of problems before they turn into cancer. Remember, getting vaccinated against HPV is helpful but does not eliminate the need for screening, as the vaccine doesn't protect against all high-risk types. Always talk with your healthcare provider to determine the best screening plan for your unique health history and risk factors. Staying proactive with cervical screenings is a vital step in maintaining your reproductive health.